Hey guys, welcome to another edition of Functional Friday. My name is Dr. Kirk Mason here at Premier Chiropractic, improving movement, function, and health. Now, on the first episode, we talked about the functional model and the three pillars of the functional model that we all need to be working together and be functioning properly, okay? Now, I'm going to dive into some of the treatment techniques that I use to be able to affect these three systems, okay? The first system, the passive system, what we mainly look at is your joints. Are your joints moving properly? What can happen is your joints can get stuck. They get locked up, they stop moving properly. This leads to compensation. You're going to start moving above and below the segments that are stuck, and it can also alter the vectors by which muscles are pulling. So it can alter the biomechanics by which your body's moving. So it's very, very important that we have that proper joint movement to avoid compensation patterns that can lead to bigger problems like degeneration and things like that down the road. Okay? So the best way to affect that joint system, in my opinion, is what's called the chiropractic adjustment, or chiropractic manipulation, spinal manipulation, joint manipulation. There's a lot of different words for it that are used in research, but I refer to it as the chiropractic adjustment. Okay? What the adjustment does is it brings proper joint movement to segments that were not moving properly before. Okay? So that's basically, in a nutshell, what's happening. And I'm going to dive in a little deeper on another video about a little more detail about that, because there's a few other things that go on as well. But at its most basic, that's what's happening, is it's increasing segmental joint range of motion. Okay? So I think that's the best way to affect the joint system. Now, there's also an active system, which is your muscles, like we talked about in the last video. Okay? The best way that I think to affect the muscular system is through functional rehabilitation. Okay? So knowing the difference between mobility and stability, and then applying the proper exercise to induce either mobility or stability. In terms of mobility, there's a few different things that we use to be able to accomplish that mobility. Some of it is like end range loading type exercises. We also use a foam roller every once in a while, make sure we can calm down those muscles. You can use things like a lacrosse ball to get into those muscles as well. Making sure that we can have that desired range of motion throughout our body is by loosening up those muscles that are too tight, and then you can start to stabilize thereafter. In terms of stabilization, there's a lot of different exercises that we utilize. There's a lot of different options out there. A lot of what we do is based on dynamic neuromuscular stabilization, or DNS. It's a technique that was developed out of the Prague School in the Czech Republic by Dr. Pavel Kolář. DNS is very, very effective at activating a whole different set of muscles than we're used to activating. So even if you can bench press, 300 pounds, we can activate muscles through DNS that you probably aren't activating right now. Okay? And those muscles that we activate can actually help in injury prevention and proper functional movement. Okay, so that's a big part of what we do with the active system. In terms of DNS or any type of strengthening exercise, we use things like TheraBands, or we use these types of TheraBands as well. There's a few different options that we have to be able to stabilize and activate muscles properly. Okay, we also use, in terms of what I do, some myofascial release or some instrument-assisted soft tissue mobilization, just making sure we can calm down those muscles, and I do that manually to the patient, so I calm down those muscles through different techniques that way. We also use what's called rock tape or kinesiology tape. Basically, you've probably seen it at the CrossFit Games or at the Olympics or things like that. Athletes really, really like it. It is a tape that comes on the skin and then actually lifts the superficial fascia, which is under the skin, and lifts that up a little bit, relieves some pressure in the area almost, and it's actually good for like bruising and things like that. It's good for pain relief. It's good for postural restoration. It's a good tool to be able to do some of those things. Okay, so we use some rock tape as well. We also do some trigger point acupuncture. Okay, if you've also heard of dry needling, it's similar to that. That would be to affect a muscle that is really, really tight and has what's called a trigger point. Okay. okay, which is just a muscle that's been pulling too hard for too long, has been working in the improper way, and now won't release like it's supposed to. So it's very, very effective for getting in there and affecting that muscle and helping it to relax. Very, very good for pain relief as well. And then finally, we also use some anti-inflammatory nutrition. We also do some sports nutritional things, whether that be in the way of supplements or just teaching someone how to eat and what to eat properly to be able to avoid disease later on, okay? If your body is in a chronic pro-inflammatory state, it's going to be harder for you to get out of pain than someone who is eating a lot of the proper things, okay? So those are a lot of the treatment options that I utilize and how that relates to all of this, okay? That's all I have for you today. If you haven't already checked out our Facebook page, make sure to check it out. It's Premier Chiropractic here, located in Minot, North Dakota. If you haven't checked out our website, it's premierchiropracticnd.com. So check that out. We got some cool stuff on there. And like I always say, if you have a problem, make sure to get into the clinic now before it becomes a bigger problem later on. So give us a call, get in, we'll get you taken care of. Okay? Thank you all for tuning in, and everyone have a great day.